It happened on a Tuesday morning. A 71-year-old man named Gerald was sitting at his kitchen table in Ohio, drinking his second cup of coffee, reading the newspaper, exactly like he had done every single morning for the past 40 years. His wife Carol was in the next room. She heard him set his coffee cup down, and then she heard nothing. When she walked into the kitchen 30 seconds later, Gerald was still sitting in his chair, eyes open, newspaper still in his hands. But something was wrong. His face looked different. One side of it was drooping slightly. He was trying to say something to her, but the words coming out made no sense. Carol thought he was joking. She actually laughed and asked him to stop being silly. Gerald was not being silly. Gerald was having a stroke. And the next 4 minutes, the 4 minutes Carol spent confused. The 4 minutes she did not call 911. The 4 minutes she waited to see if it would pass on its own. Those 4 minutes cost Gerald the use of his left arm permanently. I am going to say something to you right now that I need you to hear very clearly. Stroke is the number 5 cause of death in the United States, and the number 1 cause of long-term disability in adults over 65. Every 40 seconds, someone in America has a stroke. Every 3 minutes and 30 seconds, someone dies from one. And the most devastating fact of all, up to 80% of strokes are preventable. And the ones that are not preventable are almost always survivable with full recovery, if you know what you are looking for and you act within the first 60 minutes. The difference between Gerald losing his arm and Gerald walking out of that hospital completely intact was not medicine, it was not technology, it was not the hospital he went to. It was 4 minutes. 4 minutes of not knowing what Carol now wishes more than anything she had known. Today, that changes for you. Stay with me. Because what you are about to learn in the next 20 minutes could be the most important thing you ever watch on this channel. This is No Before 9/11. My name is Dr. James Whitfield. I have spent the last 28 years working in neurology and emergency medicine, and I have sat beside more stroke patients than I can count. I have seen the ones who came in within the first hour, the golden hour we call it in medicine, and walked out of the hospital days later with their lives completely intact. And I have seen the ones who waited, who thought it would pass, who did not want to make a fuss, who were not sure if what they were seeing was serious enough to call 911. Those patients are the reason I am making this video today, because the gap between those two outcomes, full recovery versus permanent disability, is almost never about how severe the stroke was. It is almost always about how fast someone recognized it and called for help. Today I am going to walk you through everything: what a stroke actually is inside your brain, why seniors are at dramatically higher risk, the warning signs that most people miss completely because they do not look the way people expect, the ones that come hours or even days before a major stroke that almost nobody talks about, and exactly what to do second by second if you ever see these signs in yourself or someone you love. Do not skip ahead. Every section of this video builds on the last, and the section coming up at the 8-minute mark contains warning signs that even many medical professionals overlook in seniors specifically. Let me start with what is actually happening inside the brain during a stroke. Because when you understand the biology, the urgency becomes impossible to ignore. Your brain is the most metabolically demanding organ in your body. It represents only 2% of your body weight, but it consumes 20% of all the oxygen and glucose your body produces every single minute. To deliver that oxygen and glucose, your brain has an extraordinarily complex network of blood vessels, arteries, veins, and tiny capillaries constantly pumping blood through billions of neurons around the clock. A stroke happens when that blood supply is suddenly interrupted. There are 2 main types. The first and most common is called an ischemic stroke. This accounts for approximately 87% of all strokes. It happens when a blood clot, either formed locally in a brain artery or traveled from somewhere else in the body, most commonly the heart, blocks blood flow to a section of the brain. Second type is called a hemorrhagic stroke. This happens when a blood vessel in or around the brain ruptures and bleeds. This type is less common but often more immediately dangerous. Now here is the biology that makes speed so absolutely critical. When blood flow to a section of the brain is cut off, neurons in that area begin dying within 4 minutes. 4 minutes. After that first 4 minutes, the damage escalates dramatically with every passing second. Researchers have calculated that during an ischemic stroke, approximately 1.9 million neurons die every single minute that treatment is delayed. 1.9 million neurons per minute. Those neurons control everything: movement, speech, memory, vision, swallowing, breathing, personality. Whatever those specific neurons were responsible for, those functions begin disappearing as they die. But here is the other side of that biology that gives us enormous hope. The brain has what scientists call a penumbra, a zone of neurons surrounding the core of the stroke that are injured and impaired but not yet dead. They are in a kind of suspended state, starved of oxygen, struggling to survive. These neurons can be saved, but only if blood flow is restored quickly enough. This is why the phrase "time is brain" is not a slogan. It is a biological fact. Every minute of fast action preserves neurons that determine whether someone walks out of a hospital on their own 2 feet or requires full-time care for the rest of their life. Now let us talk about why seniors specifically face dramatically higher stroke risk. Because this is something that is critically underexplained to patients over 65. After the age of 55, stroke risk doubles with each passing decade. By the time someone reaches 75, their risk of having a stroke is 8 times higher than it was when they were 55. There are several biological reasons for this. First, arterial stiffness. As we age, the walls of our arteries naturally become thicker and less flexible. This makes them more vulnerable to plaque buildup, a condition called atherosclerosis, which narrows the arteries and dramatically increases the risk of clot formation. Second, atrial fibrillation. This is an irregular heart rhythm that becomes significantly more common after 65. It causes blood to pool and clot in the heart, and those clots can travel directly to the brain. Atrial fibrillation increases stroke risk by 5 times. And here is the alarming part. Up to 30% of people with atrial fibrillation have no idea they have it because it causes no obvious symptoms. Third, high blood pressure, also known as hypertension. This is the single most powerful modifiable risk factor for stroke. It damages arterial walls over decades, creating the exact conditions that lead to both ischemic and hemorrhagic strokes. And again, hypertension is called the silent killer because it produces no symptoms until something catastrophic happens. Fourth, the brain's own vascular changes. After 70, the small vessels deep inside the brain become increasingly fragile and vulnerable to damage. A condition called cerebral small vessel disease, which significantly increases stroke risk and is invisible without specific brain imaging. Understanding your personal risk is the first layer of knowing before 911. Now we get to what most of you came here for, the warning signs. You may have heard of the FAST acronym: face drooping, arm weakness, speech difficulty. Time to call 911. This is a good starting point, but it is incomplete, especially for seniors. And I am going to give you a significantly more complete picture today. Let us start with the FAST signs because they are the most recognized and the most dramatic. Face drooping. One side of the face suddenly droops or feels numb. Ask the person to smile. If the smile is uneven, if one side goes up and the other stays flat or pulls downward, that is a stroke warning sign. Do not wait. Do not ask them to try again. Call 911 immediately. Arm weakness. Sudden weakness or numbness in one arm or one leg, usually on the same side of the body. Ask the person to raise both arms in front of them. Hold them there with eyes closed. If one arm drifts downward or cannot be raised at all, that is a stroke warning sign. Time to call 911. Speech difficulty, sudden confusion about language. This can appear in several ways. The person may slur their words as if their tongue is not cooperating. They may say words that make no sense in the context of the conversation, what doctors call word salad. They may understand what you are saying but be completely unable to respond. Or they may repeat the same phrase over and over. Any sudden change in the way someone is speaking is a stroke warning sign. Time. Not after you check one more time. Not after you call a family member to ask what they think. The moment you see any of these signs, you pick up the phone and you call 911. Because every second from that moment forward is a neuron dying or being saved. Now here is where this video goes beyond what most people know. The FAST signs are the dramatic ones. The obvious ones. The ones that look the way a stroke looks in the movies. But strokes in seniors frequently present with signs that are far more subtle, far easier to dismiss, far more likely to be attributed to aging, tiredness, or just an off day. These are the signs that cost people like Gerald 4 minutes, or 4 hours, or 4 days. Warning sign 1. Sudden vision changes. Sudden trouble seeing in one or both eyes. This is not gradual blurring that builds over weeks. This is sudden. It can feel like a curtain being pulled across part of your vision, or sudden double vision, or a sudden loss of peripheral vision on one side. Many seniors dismiss this because vision changes are common with age. But gradual age-related vision change does not happen suddenly. Sudden vision change is a medical emergency until proven otherwise. Warning sign 2. Sudden severe headache. Described by virtually every medical professional who works with stroke patients as the worst headache of my life. This is not a tension headache, not a migraine that has been building. This is an explosive, sudden, devastating headache with no obvious cause. In the medical community, we call this a thunderclap headache, and it is a classic warning sign of a hemorrhagic stroke, a bleeding in or around the brain. If a senior describes a sudden headache that feels different from any headache they have ever had before, do not give them aspirin and send them to rest. Call 911. Warning sign 3. Sudden loss of balance or coordination. Sudden dizziness, loss of balance or difficulty walking that appears without warning. This is particularly easy to dismiss in seniors because balance issues are so common with age. But there is a critical difference between the gradual balance decline that comes with aging and the sudden inability to walk or coordinate movement that signals a stroke. If a senior who was walking normally 20 minutes ago is suddenly unable to maintain balance or coordinate their limbs, that is a stroke warning sign. Not a fall risk. A stroke warning sign 4. Sudden confusion. This one is responsible for more delayed stroke responses in seniors than almost any other sign. Sudden acute confusion. The person seems disoriented, does not know where they are, cannot follow a simple conversation, asks the same question repeatedly, or seems to have lost awareness of what is happening around them. In seniors, this is extraordinarily easy to dismiss as dementia, sundowning, medication side effects, or just an off day. But sudden acute confusion, especially when it appears in minutes rather than gradually over days or weeks, is a stroke warning sign that demands immediate evaluation. Warning sign 5. Sudden numbness. Sudden numbness or tingling on one side of the face, one arm, or one leg, or any combination of these on the same side of the body. The key word, again, is sudden. This is not the numbness of sitting in one position too long. This appears without provocation. The person may describe it as their face feeling strange, their arm feeling like it does not belong to them, or one side of their body feeling oddly distant. Warning sign 6. Sudden difficulty swallowing. This one almost never appears on general stroke awareness lists, and it should. Sudden difficulty swallowing, dysphagia, can be an early sign of a stroke affecting the brainstem. A senior who suddenly cannot swallow normally, who is coughing on liquids they were drinking without problem moments before, or who describes a feeling of food or liquid going somewhere it should not. This deserves immediate medical attention. Warning sign 7. Sudden personality or behavior change. Sudden and dramatic change in personality or behavior that is completely inconsistent with who the person normally is. Sudden aggression in a calm person. Sudden inappropriate laughter or crying. Sudden profound apathy in someone who was engaged in interactive moments before. The brain controls personality and behavior. A stroke affecting certain regions can produce dramatic behavioral changes before any of the more recognizable physical signs appear. Now I want to pause here and address something directly. I know that some of you watching are thinking, but how do I know if it is sudden enough? How do I know the difference between a bad day and a stroke? Here is my answer. You do not need to know. That is not your job. Your job is not to diagnose a stroke. Your job is to recognize that something has changed suddenly and call 911. Let the medical team rule out the emergency. A false alarm that turns out to be nothing costs you an hour of your afternoon. Missing a stroke costs someone their life or their independence. When in doubt, call 911, always. Every single time. This section of the video may be the most important of everything I have shared so far, because what I am about to describe could give you days of warning before a major stroke occurs. It is called a TIA, a transient ischemic attack, and in the senior health community it is criminally underrecognized. A TIA is sometimes called a mini-stroke, but that name is dangerously misleading because it suggests something minor, something that can be watched and waited on. Here is what a TIA actually is. It is a stroke that resolves on its own, usually within minutes to hours, because the blood clot that caused it dissolved before permanent damage occurred. It produces every single symptom of a stroke: the face drooping, the arm weakness, the speech difficulty, the vision changes, the confusion, the sudden headache, and then those symptoms disappear, sometimes in 5 minutes, sometimes in an hour, rarely longer than 24 hours. And here is why this is so critical for you to understand. A TIA is one of the most powerful predictors of a major stroke that exists in medicine. Research published in major medical journals has consistently found that approximately 10 to 15% of people who have a TIA will have a major stroke within 3 months. And half of those strokes happen within the first 48 hours after the TIA. Read that again. Half of the major strokes that follow a TIA happen within 48 hours. But because the symptoms of a TIA resolve on their own, because the face goes back to normal, because the arm regains its strength, because the words start making sense again, the overwhelming majority of seniors who experience a TIA do not seek immediate medical attention. They think it passed. They think they are fine. They think maybe it was nothing. It was not nothing. It was a warning. A biological alarm system telling you that something is wrong in the blood vessels supplying your brain, and that a major event is coming. If you or someone you love experiences any stroke symptom, even if it resolves completely in 5 minutes, go to the emergency room immediately. Do not wait until morning. Do not call your regular doctor's office and wait for a callback. Go to the emergency room and tell them exactly what happened and exactly when. The medications and interventions available in the hours following a TIA can dramatically reduce the risk of the major stroke that follows, but only if you show up to receive them. This is the definition of knowing before 911 becomes your only option. Let me walk you through exactly what to do, second by second, if you recognize stroke warning signs in yourself or someone else. Step 1. Note the exact time. The moment you recognize something is wrong, look at a clock and note the exact time. This is not a small detail. The primary clot-dissolving medication used in ischemic stroke treatment, called TPA, can only be administered within a specific time window from when symptoms first appeared. Knowing the exact time of symptom onset could literally determine whether that treatment is possible. It can be the difference between full recovery and permanent disability. Step 2. Call 911 immediately. Do not drive to the hospital. Do not ask a family member to drive. Call 911. Emergency medical teams in an ambulance can begin assessment and treatment on the way to the hospital. They can alert the stroke team so specialists are ready the moment the patient arrives. They can get the patient to the right facility, one with a dedicated stroke center, which significantly improves outcomes. Time spent driving is time spent losing neurons. Step 3. Do not give food, water, or medication. Do not give aspirin unless specifically instructed by the 911 operator. Do not give water or food because stroke can impair swallowing and create a choking risk. Keep the person calm and still. Loosen any tight clothing around the neck. If they lose consciousness, place them on their side. Step 4. Stay on the line with 911. The operator will guide you through everything until the ambulance arrives. Follow their instructions precisely. Step 5. Unlock the front door. Before the ambulance arrives, unlock the front door so emergency responders can enter immediately without delay. Step 6. Gather medications. If time allows, gather the person's medication bottles or a medication list to bring to the hospital. This information is critical for the medical team. Now let us talk about what you can do starting today to reduce your stroke risk. Because remember, up to 80% of strokes are preventable. Control blood pressure. High blood pressure is the single most powerful modifiable stroke risk factor. Have it checked regularly. Know your numbers. The target for most adults is below 130/80. If your numbers are consistently above that, work with your doctor on a management plan. Every point of reduction in systolic blood pressure meaningfully reduces stroke risk. Know your heart rhythm. Ask your doctor about screening for atrial fibrillation. This can be done with a simple EKG or even with certain wearable devices. If you have atrial fibrillation and are not being treated for stroke prevention, have that conversation with your doctor today. Control blood sugar. Diabetes and prediabetes significantly increase stroke risk through multiple mechanisms including arterial damage and increased clot formation. Managing blood sugar through diet, exercise, and when necessary medication is a direct stroke prevention strategy. Move every day. Regular physical activity, even walking 30 minutes a day, reduces stroke risk by up to 27% according to research in major cardiology journals. Walking reduces blood pressure, improves circulation, helps control blood sugar, and reduces arterial stiffness. It is one of the most powerful stroke prevention tools available, and it costs nothing. Stop smoking. Smoking doubles stroke risk. Every cigarette damages arterial walls, increases clotting tendency, and raises blood pressure. Quitting at any age reduces stroke risk measurably within months. Know your medications. Certain medications increase stroke risk in seniors. Others, like blood thinners for atrial fibrillation, dramatically reduce it. Review your medication list with your doctor at least annually and specifically ask about stroke risk. Know your family history. Stroke risk has a significant genetic component. If a parent or sibling had a stroke before age 65, your risk is meaningfully elevated. Share this information with your doctor so they can adjust screening and prevention strategies accordingly. I want to bring you back to Gerald and Carol for a moment. Carol knows everything you now know. She has spent the last 3 years telling everyone she can. Her friends, her neighbors, her grandchildren, people she meets in the grocery store, about the signs she missed on that Tuesday morning. She does not tell the story with guilt anymore. She tells it so that someone else does not have to live with the same 4 minutes that she lives with. You now have what Carol did not have on that Tuesday morning. You know that a stroke kills 1.9 million neurons every minute it is not treated. You know the fast signs. You know the 7 warning signs that seniors most commonly miss. You know what a TIA is, and why it is a medical emergency even when the symptoms disappear. You know to note the time. Call 911, stay on the line, unlock the door. You know that time is brain, and now that knowledge belongs to you. Share this video with every person you love who is over 60, with their children, with their caregivers, with anyone who spends time with a senior in their life. Because the person who needs this information most is very rarely the one who finds it on their own. This is Know Before 911. Because knowing first is what changes everything. If this video gave you something today, please subscribe to this channel and hit the notification bell. We publish new videos every Tuesday and Friday specifically for adults over 60 and the families who love them. Leave a comment below and tell me, did you know all of these warning signs before today? Which one surprised you most? I read every comment, every single one. Take care of yourself, and know before 911.